Hey, how you doing? That video was cool. I loved how they stirred together somebody's background, the life that they experienced with problems that could come of it, and then they explained it psychologically, physiologically, and they looked at interventions, and it was just like, that was so cool. Um, and so, like, now you get to do a lit review about it. Like, what are we going to do? My name's Dale. I'm your librarian, and I'm here to help. This is just a quick starting video if you want to reach out to me, or if you want to reach out to me like with Teams. I realize that the deadline for this is coming up kind of quick. But reach out. I'm at dale.larson@utah.edu, and I can consult with you, send you answers, give you validation, meet with you. We could meet on Zoom, meet in person, or I could just, make videos like this. So, confronted with this assignment, here's what I would do. First of all, when I first saw the assignment, I got heart palpitations and I started breathing heavily, and I was just like going into an anxiety attack. So I tried to break it down for you. I'm laughing because I'm just like, oh, what would this be about? So if you're feeling nervous, that's a natural feeling. If an old librarian freaks out, then you're allowed to freak out too. So let's take this in small bites. First one that I'm going to look at is this right here, where we looked at the sections of the person's life, and then like the research questions. We get to pick one of them. And I'll show you how to approach expanding your knowledge on that in a way where you can start to build evidence. So scholarly evidence, peer-reviewed articles, valid websites, service agencies, and things like that. And that's this first section: keywords, main points, related terms, and synonyms. And once you get the hang of that, you'll be good to go and build into our next section. And that would be like, where do I look for this micro level, mezzo? Is it mezzo or mezzo? And macro level. How do I get into that? There's a lot of words in there, and it's easy to get flustered. So hopefully this will be like a deflusterification video. Okay, first place to start. When you pick one of the questions, I'll go through a couple of these, but when you pick one, pick it because it's something that interests you, or if it's something where you're like, oh yeah, I know something about that. That'll help you feel comfortable more quickly. If you're going in cold and you don't know any of these, then here's how you would go about it. So for example, on this one, what does research say about long-term impact of racism on childhood? Well, we've got 3 sections. Long-term, I don't know if impact would be a keyword, racism, and childhood. How would we expand on those things? So let's go to the library catalog. Let me show you a couple tricks. First of all, you could just throw those keywords in there. Oh, I got to sneeze. If I suddenly sneeze. Oh, excuse me. That's going to be like an audio spike in the video. Go to the advanced search, and here where you can see you can add a new line. Type in 1 keyword for each section. So long term. If it's more than 1 word, put it in quotes. Or what's another way of saying long term? Lifetime or longitudinal. Think of all the synonyms and related terms you can think of for that 1 keyword. And then, let's go back to our other one, racism. What's another word for racism? What might be racist? Or it might be discriminatory. Did I spell that right? Or discrimination. Or, there's all sorts of different keywords that you can go along. Lastly, I would say for publication date, you can do this after you search, but I would say let's try and find something in the last 5 years. And you could put any number of keywords in, and you're going to get results. And what they do is it's going to look up long-term in the title or the abstract, the description. It doesn't typically go through the full text. And if it can't find long-term, then it's going to go look for lifetime. And if it can't find that, then it's going to longitudinal. So you get kind of like all 3 keywords in one fell swoop. So if one of them doesn't work, You can go back and edit that. But down on the right-hand side, you can see, well, maybe I want to get peer-reviewed articles, so I know that it's the good stuff. And I'll apply filters. And all the keywords that you add will narrow this down even farther. So when you click on search again, whoops, maybe I want to go to search criteria. There, you can do your search again. So you can add keywords. So if I'm looking for children or adolescents or blah, 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 you can keep on narrowing it down every time you add another line. So I got 497 children and school or education. Do you see every time that I add something, we get less results? It's still 294. And then let's look up, let's add COVID-19 or pandemic. You get the idea. Every time you add another set of keywords, it's going to narrow it down even farther. And then here we get all sorts of different things, and you get to decide whether they're good or not. How would you do that? Well, let's do another search. What's another one? What does research say about black people? Black people dying. And you could, write out synonyms as you go. Health disparities. Blah, blah, blah. Okay, let's go back. Let's clear everything. Is black people the correct term? Here's a way of testing it. If you're not sure about a term, is it African American? Is it black people? Is it any number of different iterations? You can go through in the subjects and you can look for synonyms right here. Looks like black people is, but there's also African Americans. So that might be a key term that you add. Social construction of race, you might want to throw that in there. Racial differences, minority and ethnic groups, ethnicity. There's all sorts of different ways of describing all sorts of different demographics or different values or criteria and things like that. So beware that even if you only have one set of keywords, you can always go back in and add more. African American. And so we have 929. And if we wanted to, this should, when you add an or statement, it should add to that. Yeah, 11,000. Whoa, African American was much better than looking at black people. So think of synonyms. That's an important thing to do. So as you go throughout whichever research question you start with, break it out into those main key points. Typically, it's the name of a population. It's the problem we're looking at. So it might be health disparities. One of the outcomes of health disparities is death, mortality rates. You could think of all those different iterations and add them in the line. Okay, that's the first thing. When you get this done, and make sure and write it down. I use Microsoft OneNote, but you can use like notepads too. Once you get that settled out, it's a lot easier to move forward into databases. So the library catalog's great, but it doesn't allow you to focus into psychology specifically, which would be the micro, or in the macro. I have a couple databases suggested here. How do we get into that? And how do we get into those recommendations? So we don't freak out about the micro interventions, mezzo, or macro. I'm going to show you ways of getting around that, where those things will appear naturally. Okay. So in the library homepage, oh, by the way, if you find an article that you want, when you click on it, there's a citation generator. So you could do APA or whatever style you're doing. They're usually right, but this one is incorrect. Like this should be lowercase d. That should be a lowercase c. So you might have to do some corrections. That should be lowercase r. Also, when you click on this full text available, it should send you to the full text. If you don't get full text, yeah, here it is. If you don't get full text or you can't track it down, send me an email and I'll help you track it down. Yay, full text. And you can email yourself, and those have citation generators too. Library catalog's good, but it's kind of a generic mishmash. So think of Walmart, Target, grocery store. It's kind of got a little bit of everything. But we want to be more specific and go into databases. So this is the second part. I should hold up like a big number too so we can skip ahead. Second part of the video, databases specifically that I'd recommend. When you go into databases, you can go in by discipline. So I noticed one of them was related to education. There are education databases. So you can go into this one. Let's see which question was talking about education. Oh yeah, not graduating high school. This is where you would go in for educational outcomes. And this would talk a little bit about psychology. It would talk about interventions. Maybe it's like something a counselor would do in a K through 12 or a college situation. So it's all kind of mixed together in that discipline. So it's okay to go into these discipline-specific databases and look for things. Also, there is a set of databases for social work. There's a set of databases for psychology. So you can go through these and try them out, but I made an index for you. So if you go to research guides right here and type in social work, I'll show you my favorite ones. Social work. Every library produces guides and for their specialties. And if you click on this one right here, or if you go to campusguides.libutah.edu/social work, I'm going to put that on this so it shows up more often in the video. So I haven't updated this one for a little while. I'm kind of ashamed to say that. Let's call it the pandemic. But if you go to PhD and Master's Help, here's my suggestions for finding those things you're looking for. The first section, validating keywords and concepts, we just did that, where you're trying to find, if I say this word, is it going to get the population or the intervention that I'm looking for? You can back it up in the library catalog, newspapers, and things like that. So let's move forward to the specific databases that I recommend. Sociological abstracts, I adore, because it covers aspects of society from the kind of like a policy and societal level down to smaller interventions. So it's a good catch-all. Let me show you PsycInfo first. PsycInfo is the darling of social work people. Oh, by the way, did you know in advanced search, you can see the same situation that we had before. So let's try this one, sickle cell anemia. Sickle cell, and here's an interesting thing. It says sickle cell disease, sickle cell anemia, sickle cell crisis. Which one do we use? I would say take off the end and just look up sickle cell if they're looking in psychology. And then let's look up Black people or, oh, look at this. They give more synonyms. Or African American, or people of color. Isn't that cool? Gives all sorts of suggestions. And we know what's the research on sickle cell anemia, outcome studies, and the impact on the Black community. Well, since we're in psychology, we know that they're studying a population who's affected by this problem, and they're examining it. Let's see. So they're comparing two populations, people that have it and people that don't. The impact of spiritual counseling. They're talking about getting people to donate blood. Awareness. Working with teens. Hearing loss. So when you're looking at a literature review, be aware that there is a lot going on and there's no right answer. So when you do a lit review, you're proposing, these are the things that I found interesting, these are the things that I found relevant, and that's not a wrong answer. So the first time I did a lit review in a master's degree, I was thinking, oh, the person knows everything. Well, they don't. If there's like millions of things published every year, if you find that there is psychosocial aspects of sickle cell disease, a primer for African American psychologists, if you find this a valuable article, then it matters, and it should be in your literature review. By the way, there's a little citation generator here. You can email yourself the article there. The View It button is here. Isn't that cool? So as you start, dig away at these things. And I'll have one last strategy at the very end of what do you do when you have a pile of articles. So the next one I wanted to show you, let's go back to that guide. Next one I wanted to, and I would encourage you to try all of these. Sociological abstracts rocks, PsycInfo rocks. But when we're looking at that macro level, so for example, homelessness in Utah is a thing that politicians are talking about. Social workers, agencies, all sorts of different organizations and people are talking about this. And they're like, well, what should we do? What has been done? How can we assess this? PAIS is really good at the larger macro because this is public policy. And miracle of miracles, they have another advanced search. So on this one, what have I not done? Oh, long-term impact of racism. Long-term or longitudinal. Oh, my spelling. Oh, look at that. Do you know what a longitudinal study is? That's where they study people in childhood, and then they study them again when they're teens, and then they study them as grown-ups, and they do the same methodology. And let's look at racism. That one's a pretty solid keyword that has a lot of symbolism, but it's a pretty tight description. That one might not need synonyms, but we want to look at childhood. Childhood or children or adolescence. Oh my gosh, Adolf Hitler's childhood. That's interesting that that shows up here. Adolescence. Oh Lord, help my spelling. What do we have here when we have adolescent, adolescence, adolescence as a plural? You can put a star there and it'll catch all of those different iterations. Let's see what happens. Again, we're looking in public policy. We're not in psychology anymore. Ooh, look at that. Why would a society measure this sort of a thing? Because we have students that come to college and that drop out. We have people that go and don't graduate high school. We have people that don't meet certain criteria for X, Y, and Z. And we want to mitigate those things in a society. And so these are policies. This one is heavy with dissertations. So I would say let's go straight to scholarly journals. And there's some books. And it goes back to 1939. Let's come up to our current decade or so. And do I have to put, no, I picked scholarly journals already. So differential impact of universal prevention program. Look at that. That's an intervention. When you go down to macro issues, what systematic and policy changes could benefit other children in that person's situation? Well, maybe universal prevention program. As you find things, try and place them into the puzzle pieces of this rubric that's yellow highlighted, and you might find yourself finding stuff quicker than you thought you would. There's like ACE screening. There's home visit models. Home visit models. That sounds like a meso specific services or agency. See how this lit review almost writes itself. Maybe it helps if you have a lot of extra coffee, like I did today. Look at that. Data inquiry with COVID-19 in Black children and adolescents. So these are really great. If you find one that's really good, where you're like, oh, that's exactly what I wanted, click on that article and you can go into their metadata. You can go into the references, obviously, but where's my metadata? Oh, here we go, abstract details. If you see anything that looks really good, risk assessment, prevention, mitigation, there's all sorts of extra keywords that the author, or authors in this case, supplied, so you can find more on this topic. Oh, and here's a little citation generator. You can email yourself an article here. Okay, one last thing that I wanted to show you. Let's go back to my guide. So all of these are good. This is society in general. These are worth a try. You can see the bigger ones I like better. PsycInfo, Education Full Text. Business Source Premier is a total dud, but if you're interested, it might have something. PAIS, I adore. CINAHL and Medline are fantastic because there's interventions at the hospital level where somebody comes in and they have to assess for all sorts of different things, racism, discrimination, you get the idea. These are pretty good, these last three, but this Scopus and Web of Science are very important. If you find you get too much stuff, these are great for narrowing it down. So let's look at, what's another one? Okay, long-term outcome of orphaned Black children. Okay, and this one we can add search fields just like the other. So let's do Black children or African American children. Maybe we should do the quotes or the star, because then we'll get children and childhood, if that makes sense. And in this one, not longitudinal, longitudinal. Oh, I wish I could edit video so I could skip my spelling. Longitudinal or long term. And then what was the last section? Oh, orphan. Orphan. So orphan, orphanage, orphans, all can get caught with that little star next to it. What is, if there's too many articles, let's see how many do we have with this. Oh, there's only one. That does not always happen. Well, there we go. Oh, look at that, colored orphans. That's a very atavistic, out of time. But if you only have one, in this database, you can go into there. Oh, maybe you can't. You should be able to go in to see what they cited. But if we want to change it, let's get rid of this one. If you get too few, reduce your keywords. Hey, all of a sudden there's 14. Ooh, I didn't think about caregiver. Look at that. Orphanhood. I never thought of that term. How do we know which article is the best when we have 14? You can go over here and click on Cited by Highest. Scopus and Web of Science are the only ones that do this. And so here we can see the AIDS epidemic in relation to our keywords that show up in the title or the abstract. Arguably, this is the most important article on the topic because it's been cited 42 times. These 42 articles couldn't exist unless this one happened. So COVID-19 associated orphanhood and caregiver death in the United States. That one sounds like it's right on, but since 2021, it was so important that 32 articles came out of it. So let's see what those are. And we can look at those by the number of times cited. Children, orphanhood, pediatric emergency department. So is that a mezzo? Oh man. These all look really good. But you have to pick the ones that you think make sense to you. How do you figure that out? Is if you understand the title. So children's mental health. If you go in and you read the abstract for an article and it makes sense for you, that's a good one. If you can pull out an individual item, an individual thing that it was saying. So let's look at this one. That one sounds kind of like an opinion piece. Mental health minority, marginalized young people, an opportunity for action. Where's my abstract? Well, at any rate, you get the idea. You should be able to glean a major point, and if it's a peer-reviewed journal, it'll have all of the metadata and the credibility and the peer-reviewedness that you need. So as you go, let me know how it works, and again, you can reach out to me at dalelarson.utah.edu. Ooh, the last thing I was going to talk about. How do you put all this together in a way that makes sense? Imagine a river. and you're trying to get your grandmother from one side of the river to the other side of the river. My grandma is like a zillion years old, so that would be a tough thing. Imagine information where I want to tell my grandma about what it's like being African American, being orphaned, and what it's like going through life with different disadvantages, what things people could take advantage of, things that could help, missed opportunities, and all sorts of stuff. She doesn't understand that, but the knowledge is on this side of the shore. So what I would do as I walked her across, each stepping stone is an individual point that helps her make a logical step towards understanding that point of view that we created. Let me know how it goes, and I'm happy to help. Sorry for the long video.